So looking for Module 6, I looked into health communication, and I found that the communication between a healthcare provider and a patient is very, very important. Whether it comes from just asking what is wrong or being able to ask history questions about that patient's individual life, or if they have any significant other they'd like to call in case of emergency, that the communication between a healthcare provider and a patient is very important, and the attitude and all the information that is given or received um, plays a huge role in the treatment plan or anything that's going on within the hospital with that patient and healthcare. And the more information that they can get, the better it is helpful to the hospital healthcare provider in general. And so with that, it made me ask the question that what happens if a patient comes into a hospital or healthcare facility and they do not speak the same language as their provider. Like, they can't understand them at all. Like, they wouldn't be able to get any background information to be able to give them the right procedure if they're in danger, like in the ER especially. Like, if there's an emergency and they need to help this person, but they don't know anything about this person's past, and they don't want to cause any more issues without knowing the person's past, how do the healthcare providers deal with that type of situation? So it got me thinking, and basically what I speculated is that maybe they would find someone in the hospital who does speak their language, or they would try to just translate it as much as they could, but that also is a very gray area, so it kind of left me guessing. But after talking to my older sister, who's a nurse practitioner and works in this facility, and doing a lot more research on it, I found that a lot of hospitals have gained procedures that deal with this specific type of situation, and this has become a more and more frequent issue within the United States, specifically because they have a lot of immigrants and other people that's more common of not speaking the English or the main language that we do speak at our hospitals. And they do have different types of protocols that they use to handle these types of situations in hospitals and healthcare facilities that allow them to communicate with these individuals and communicate with patients that may or may not speak the same language as them, to get them the benefits and procedures they need to be done in the safest and easiest way possible, whether it be bringing in someone or translating or having a program or place in the hospital they can go to get all the information they need. So